Hi friends, this is Dr. Sumna. So today with me you're going to learn the fertility indicators, which is a very important topic for your NEETPG, FMGE as well as INICET examinations. Okay, so let's learn fertility indicators in just 5 minutes. So what do you mean by fertility indicators? So these are indicators or numbers that gives you the reproductive performance of a population, and it helps to understand the population growth of a country as well as to plan the family welfare programs. Okay. So starting with the first indicator, which is the simplest one, that is your CBR or crude birth rate. Crude birth rate gives a total number of live births. Total live births come in the numerator, okay, divided by the total mid-year population. Okay, so the denominator has the whole population. Numerator has only the total number of live births. So this is your crude birth rate. And when I say mid-year population, it is estimated on, or it's a population taken on July 1st. So what's the disadvantage of crude birth rate? See, the denominator has both male and female, but male population are not exposed to the risk of childbirth. Okay, so we need a better indicator. Here comes your GFR or the general fertility rate. Again, here the numerator is the total number of live births, but in the denominator we are taking only the mid-year female population or the women in the reproductive age group, that is 15 to 49. That number is being taken in the denominator. Okay. So it's of course better indicator than CBR. You agree with me, right? And but there's one disadvantage. What is that? See, not all women in the reproductive age group are exposed to the risk of childbirth. Now we have another indicator, which is your age specific fertility rate. Here we are measuring fertility for a specific age group. Okay, so the formula is total number of live births in a particular age group divided by the mid-year population of that particular age group. That gives the ASFR or age specific fertility rate. Now coming to the most important indicator, that is a TFR or total fertility rate. So total fertility rate, in simple word, it is the average number of children a woman would have in her lifetime. Okay, so TFR is measured by getting the average of all the different age specific fertility rates. Okay, that average gives the value of TFR or total fertility rate. So the definition is average number of children a woman would have in her lifetime if she were to experience the current age specific fertility rates of our country, and it is the approximate measure of the completed family size. Another important MCQ, TFR equal to 2.1, that is what you call as the replacement level of fertility. Okay, next one is the gross reproduction rate or GRR. Okay, till now all the numerators I told had total live births in the numerator. All the indicators had total live births in the numerator. Here we are going to have only the total number of female live births in the numerator, or GRR or gross reproduction rate is total number of girl children a woman would produce in her lifetime, and here we are not considering mortality, or GRR is the total number of female live births in the numerator without considering mortality. Now we have something called as NRR or net reproduction rate. Net reproduction rate is the total number of female live births per woman but considering the mortality. Okay, what is the difference between GRR and NRR? GRR does not consider mortality, NRR considers mortality. Now remember, GRR and NRR both has two R when you write in the short form. So remember that R for the extra R for daughter. Daughter ends with an R. Son does not have an R. Okay. So both NRR and GRR have in the numerator only the daughters or only the female live births. That is one important point. Rest all the indicators had the total live births, meaning both son and daughters were included in the numerator. One more MCQ point, which is the indicator which takes into consideration mortality, that is nothing but your NRR or net reproduction rate. Now finally, we'll stop with these MCQ points. So NRR is the average number of daughters born to a woman who survived to reproductive age. That's why we told mortality is being considered. Now NRR is one that is called as the replacement level of fertility, or that is the stable population, means one female just replaces herself. That is what you mean by NRR is equal to 1. So if NRR is less than 1, you have a declining population. If NRR is more than 1, you have a growing population. So to achieve NRR equal to 1, or that means your TFR is 2.1, you need a couple protection rate of more than 60%. Again, repeatedly asked MCQ. Okay. And what's the relationship between your GRR or NRR and TFR? That is GRR or NRR is equal to half into TFR. This is again another important MCQ. So with that, we are ending this video. Hope it helped you. Thank you.